Hello, and welcome to one of our 11 Together to Goal Campaign Plank Mentor webcasts. Today we'll be hearing from Dr. Mark Greenwood of Intermountain Medical Group. Dr. Greenwood is the Plank Mentor for the Integrate Emotional and Behavioral Support Campaign Plank. Dr. Greenwood, thank you so much for joining us today.
Well, thank you for the invitation. The pleasure is truly mine. Maybe just to share a bit about myself, first of all. So I'm a family physician. My primary background's been in rural medicine for most of my practice career, doing full spectrum family medicine, and then I've had the privilege and opportunity the last few years to transition to more administrative and quality improvement work, and really gotten involved in developing care process models and driving improvement in care delivery here at Intermountain, both for diabetes as well as other primary care conditions. Maybe for those who aren't familiar with Intermountain Healthcare, we're headquartered in Salt Lake City, Utah. We're an integrated system. We have hospitals, health plan, and then a medical group with about 1,500 providers, mostly physicians, but also a growing number of APPs. Our ultimate mission is to provide high quality, low cost care to the citizens of the Intermountain West, and of course, consistent with the triple and quadruple aim, to also do so in a service-friendly, access-friendly, and provider-friendly manner. So that's maybe just a little bit about who I am and who we are and what we're trying to accomplish.
Wonderful. Why don't you tell us a little bit about how your team has integrated emotional and behavioral support into diabetes care?
Well, and to really, I think, tell the true story is to take a step back and say that it really isn't just a commitment to doing that for our diabetes care, as most of our patients don't, especially in primary care, just come to us for diabetes. They're coming to us for total care. And so really is to take a step back and say 10 or 15 years ago, we really started down a path or journey to say that the way to best deliver primary care is in a team-based fashion. And at that point, we started something called mental health integration, which was to start to embed mental health providers into our clinics. That, of course, takes time to implement, and that's really been the foundation and has led into then the realization that there's more to it than just embedding a mental health provider. And that's resulted then, of course, to the addition of care guides and care managers, to where really we don't necessarily talk about just mental health integration anymore. We talk about team-based care, that it really takes more than just a physician to provide care for complex patients. And diabetes, of course, is really maybe the most complex condition of all, with the needed components of medical advice and nursing education and socioeconomic factors that all play together to result in the good or bad outcome of the diabetic patient. So really it's more of a philosophy to overall care, but then can be applied more specifically to diabetes.
Wonderful. Can you talk about the value of having leadership support and buy-in for this effort?
Well, it's necessary but not sufficient. How's that? Leadership set strategy and culture for groups and organizations, and ours is no different. And the things that come out of that, of course, are the messaging, what you manage, what you measure, the incentives that are delivered, and then perhaps most of all, resources. Ultimately, leadership tends to allocate resources, and there's no doubt you can't deliver team-based care without a team. So without the leadership support, it definitely won't happen. But then there's still the buy-in on the frontline folks that are actually doing the work for it to truly succeed. So you definitely have to have both.
Great. And what would you say is the biggest challenge that you've encountered, and how have you addressed it?
Boy, it's tough to necessarily identify one challenge. I mean, there are clearly multiple challenges in changing the way you deliver care. I mean, we talked about just resource allocation and convincing people that it's the right thing to do, first of all. Another one, ironically, is pushback and resistance by physicians themselves to change. Team-based care is not the way most physicians learned how to care for conditions, including diabetes. And so the education of the providers and getting their buy-in and support, ironically, has been one of the biggest challenges. It's overcomable, but it does take messaging, it takes support, it takes time, it takes patience to convince physicians to change the way they're used to practicing.
Great. And for an organization who wants to better integrate emotional and behavioral support into their diabetes care, where do you think they should start?
Well, I think we mentioned that first of all is that you have to decide organizationally that that's something that you want to do. Until you've set it as a priority and a strategy, then you're not going to truly commit the time, attention, and resource to make it happen. So first and foremost is to commit to it on a high level. And then really it's two or three things from there. Then you have to build that care into your, and here we call them care process models, but I think most organizations have similar concepts of standards on how they want to take care of different conditions. And then as you make that decision, you can allocate the resources and build the team to deliver that care, and then start to implement with the physicians and the teams. But it's a process. I mean, we started this literally 15 years ago, and we've only been truly implemented and staffed in all our clinics for about the last 3 to 4 years. At least in a big organization like ours, it's a process. So some of it is you have to just be patient and persistent as well.
Great. Well, thank you, Dr. Greenwood, so much. We really appreciate your taking the time today to share your insights and expertise on this campaign plank.
Well, you're very welcome. It's the right thing to do. Like most things, it's not easy, but it's definitely worth it, and it does result in better care, lower costs, and a better experience for the patients and the care team. So it's not easy, but it's worth it.
Wonderful. Well, as a reminder to fellow participants, if you'd like to contact Dr. Greenwood to discuss implementation of the Integrate Emotional and Behavioral Support Campaign plank at your organization, email t2gmentor@amga.org. Check out our remaining Together to Goal Plank Mentor webcasts at www.togethertogoal.org/Plank Mentor to discover what other experts have done to improve diabetes care across the country.